Good morning, good afternoon, good evening, and good night. Welcome to everyone. My name is Paul Wright. I work for Alberta Health Services within the NRV SCN, the Neuroscience Rehab and Vision Strategic Clinical Network. We're here to talk to you today about PJ paralysis. So let's say goodnight to our hospital gowns and do our best to get our patients up, dressed, and moving for better health. It's important to outline our partnerships, not only with Alberta Health Services, but with Covenant Health. And I'd like to introduce you to my friend and colleague, Melissa Zinn. Melissa.
Thank you so much, Paul. Melissa Stim, Corporate Director for Covenant Health Professional Practice, Clinical Learning Libraries, and Student Placement. And I'm really happy to, alongside Alberta Health Services and the NRV SCN, to be here to really endorse the importance of getting up, dressed, and getting moving as we look to support Albertans through isolation within clients within COVID and beyond. We know that throughout the pandemic, Albertans were restricted to hospital beds, resident rooms, or homes, and physical and emotional implications are far-reaching, more so than we've ever seen before. Through a revitalization of the basic concepts around PJ paralysis, Covenant Health and Alberta Health Services, in collaboration, turn to support providers, patients, and families to ensure our days include client-centered, unique, purposeful, and meaningful activities, starting by getting up, getting dressed, and getting moving. Covenant Health is proud to partner with the NRV SCN, and we want to thank Paul Wright for providing this provincial leadership, as well as this group, as well as our Covenant PPLs, Whitney McKenzie and Sharon Simiak, who you will hear from later on, to really spread and scale this good work. Together, through collaboration, we will make a difference for those we serve.
Thanks, Melissa, and thank you for outlining our journey together. We know that we've had a bit of a pause with what's happening in our world right now, but our journey forward is going to be important to get our patients up, dressed, and moving. So thank you for sharing the collaboration with Covenant Health and Alberta Health Services. So what's going to happen on our call today? We're going to go over what is PJ paralysis and why it matters. And we also have two special guests that we're going to talk about some resources that were developed during the pandemic, outlining some of the things that we can do to get our patients out of that boredom and isolation phase. So we're going to hear about some resources that are going to help us move forward. And it's called No Healing, Staring at the Ceiling, and we'll unpack those with you. But as I mentioned, and as we always start these calls, we're going to go over just what PJ paralysis is and why it matters to you. So PJ paralysis is a term to describe the negative physical and psychological effects experienced by patients who spend lengthy periods of time in bed or inactive in bed, and often in their hospital gown or their pajamas. We know that people on lengthy stays can lose their muscle strength, which can lead to longer hospital stays and complications when going home or even transitioning to different centers. Wearing only pajamas can also make a person feel less human, more vulnerable, and consistently reminds them that they're ill. PJ paralysis with Alberta Health Services focuses on two main aspects. One, respect and dignity, and two, deconditioning. Respect and dignity is about understanding and allowing and giving the patient permission to wear the clothing that they want that's safe and comfortable. It gives them a sense of identity, allows them to question their care staff, and they feel less institutionalized when they are able to wear their own clothing. We also know by wearing their own clothing, they're more apt to get out of the room and support us with that deconditioning message of getting up and moving. The deconditioning piece in Alberta Health Services and Covenant Care often focuses on how do we get patients up and moving out of our physical environment. We know that bed centricity, or how we provide care, is often around the bedside. And how can we support that and change that so people can be as well and as healthy as they are in the hospital as out of the hospital, and focus on those goals? So deconditioning, although the environment can be challenging, we're really trying to promote those patients, get creative, and see what we can do to get them up, dressed, and moving. I want to go over why this is important. So we know if we spend a week in bed that we can have some negative statistics. Although we feel that sleeping and staying in bed can be a sign of healing, it absolutely can be. But we know when people spend lengthy periods of time, as I mentioned before, it can actually be quite harmful. So we know if you spend a week in bed, you'll lose up to about 20% of power off your quads, or about 1.5 kilograms of muscle loss. We know our quads are huge for the movement and activation, especially in our legs. We also know that we could lose about 10% of our aerobic capacity, or our lung volume, how much air we can take in and breathe, and helps with our conditioning. Some of our physical therapists or respiratory therapists would equate this to smoking a pack of cigarettes a day, how negative conditionings can have in our lungs and our volume recruitments. But that's not all. We know there's many other factors that are associated with inactivity. We know that by having patients or family members, or patients in the beds for longer periods of time, we increase the risk of disabilities. We increase the risk of chance of needing supports with activities of daily living up to 1 month after discharge. So help with things like getting dressed, making meals, toileting or bathing, or even transitioning. We also know in the largest one there, that 5X, there's 5 times the risk of needing institutional care on discharge. And this is really important. How can we have our patients strong or stronger leaving the hospital than they came in to potentially avoid a transition that wasn't necessarily needed for care outcomes? We also know that PJ paralysis isn't about getting up and moving. It fits and supports many other aspects of care, such as bone loss, malnutrition, delirium, pressure injuries or pressure ulcers, blood clots, or our new terminology, venous thrombosis embolisms, and patient falls. So it's important to understand that it can support many initiatives by not only thinking about your physical, but also your mental health. Here, and apologize for being a bit cheeky and showing this gentleman's rear to you, but what I wanted to outline was that deconditioning piece, but also the importance of respect and dignity. Patients outlined, and one of the main reasons we started this work in Alberta Health Services and within Alberta was to outline that patients wanted to wear their own clothing and in many instances thought they should be allowed to. There was a study between hospitals in Toronto and Montreal that outlined about 60% of patients would have loved to wear their own clothing, but only about 10% were afforded permission to do so. So again, thinking about that institutionalized feel, and I'm sure anyone that's been in a hospital for a long period of time, unfortunately, has seen this view. And what can we do to avoid that, to get this patient to have some dignity, but also feel comfortable to ambulate within the hospital setting? The last thing I'll share with you before we transition to our guest speakers today, and again, is just to show that this concept of getting up and moving in a hospital is not new. We have our British Medical Journal, 1947. Dr. Asher outlines that going to bed is dangerous. He outlines and tells us, teach us to live that we may dread unnecessary time in bed. Get people up and we may save our patients from an early grave. So again, this is not a new or novel concept. This is not something that's innovative, but what is innovative is thinking about how can we support patients in the current climate, within the current policies, within the current procedures, to outline that one of the important things that they can do for us and we can do for them is to get them up and moving while they're in our care. Lastly, I want to leave you with a quote from Michael Del Sandro, the Director of Medical Nursing at Johns Hopkins Bayview. He's outlining to us that by focusing on mobility, we're able to improve patient outcomes, expedite recovery time, and shorten length of stay. Introducing this initiative has led to greater patient engagement and improved patient experience. More importantly, we're able to bring patients back to the sense of independence in such strong, true telling words as to why this initiative is so important. I'd love to switch and transition to our callers here today. I would like to introduce you to Deb Reynolds and Casey Aiello. Deb Reynolds has served her community for 39 years, working with vulnerable populations as a social worker and advocate. Deb is a mother of 27, yes, you heard that right, 27 children, 4 of her own and 23 sons through fostering children, and a grandmother to many. Her passion for walking with those who often walk alone has guided her career as she's worked in sectors of domestic violence, homelessness, mental health, and addiction. Deb's belief is that when a community stands together, no one is left out, and through belonging, healing and hope can begin. Deb works with Alberta Health Services as a consultant and continues to volunteer for her community, and when she can, camps all year round and captures wildlife with her camera. Thanks for being here today, Deb. I'd like to introduce Casey Aiello. Casey has been a part of the Calgary Zone Patient Family Center care team since 2018 as a patient liaison for the Department of Clinical Neurosciences at the Foothill Medical Center. Casey provides direct peer support for those that have had strokes, brain injury, and spinal cord injuries. She has over 22 years of lived experience of living an adaptive lifestyle as a C6 quadriplegic. Casey enjoys getting out into nature using her accessible bike, doing skiing, and being with her son and husband. Casey, Deb, thank you for being here today, and I will pass the microphone to you.
Thanks so much, Paul, for inviting us. It's great to be here. I just want to share a little bit about how we came about to develop this document. We learned really quickly early on that patients were actually worse off when they were leaving hospitals than before they arrived, simply because of COVID and the isolation and loneliness that they were experiencing. And it was interesting. I was at Children's Hospital with my 7-year-old granddaughter, and her 4-year-old sister said, "Nana, why is she just laying in the bed?" And I said, "Well, that's where she has to be to do her healing." And she said, but there's no healing just staring at the ceiling. She needs to get up. And so that's where the title of this document came from, No Healing Staring at the Ceiling. And we were really blessed to work with 2 advisors, patient and family advisors, in the development of this document so that we were able to continually keep that patient and family lens on the work as we moved forward, because it's so critical that we do it with our patient and family advisors and not just to them. So the why of this all came about due to the COVID-19 survey results, which really indicated the emotional pain of patients and families while they were isolated and the loneliness that suddenly started to settle in, and then the impacts of that. And we also learned the impact and distress that this was causing to the staff as well, who were trying to provide care, and the family members who were at home and really missing out on the communication that they felt they should be getting, supporting them and understanding what was going on with family members that they couldn't be present with at the time. So the patients reported a lack of communication. Families reported they weren't informed of options for communicating, and this caused a lot of distress for both the patients and families, as well as a sense of isolation, the lack of motivation, and a growing disconnectedness from their lives and from the people around them. This also then, as Paul had mentioned, showed up in an increase in falls and an increase in the use of restraints to try and help patients be controlled while they were feeling more and more disconnected and lost. Casey?
In addition to our professional roles, we realized that our unique personal experience enabled us to see this through many different lenses. And I think that's one of the reasons why Deb and I were really suited for this project. This dashboard on Tableau contains information related to the COVID-19 inpatient patient experience in Calgary Zone hospitals, and it's from March 2020 onwards. It was a tremendous collaboration, as seen here, and I've added the QR code if you wanted to take a snapshot and take a look. The target audience were patients and families who stayed in Calgary Zone hospitals with the diagnosis of COVID-19 who were 18 years of age or older. And I have to give a shout out to Food Services. They were the amazing ally in supporting the distribution of the QR codes on meal trays. This survey gave us insight into the patient and family experience. Shown here is some of the data and patient demographics from that survey on Tableau. We understand that boredom and isolation were also enhanced by inactivity and a disconnect from wellness. I will now be sharing a few quotes from that survey. Those who are in hospital, you could give them more mental support, a counselor, or someone who can make them mentally fit. They're totally isolated. It's a very lonely hospital experience. And isolation was horrible. The doctors and nurses would come in and they would be completely gowned and you never got to see a face. It's hard not to see another face in isolation.
And so some of the quotes that we were able to gather out of this survey really guided us into an understanding of what it looked like from the patient family side during COVID and during times of isolation. When you see someone saying, when you're sick like this, your mind races because you don't know what to expect. And of course, patients reported that seeing staff less, having their doors closed, and feeling disconnected from those who are around them to support them really increased that sense of isolation. One quote was, they should have had a TV or Wi-Fi or something to help them out because they're sitting there for 24 hours a day and sometimes not even sleeping. You could be there for 2 weeks, so TV or good Wi-Fi system is necessary. Put it this way, if I don't have my phone or a good Wi-Fi plan, I don't know how I would have survived because it's hard being in isolation. Some people are depressed, and we know that there was such an increase in anxiety and depression and disconnection because of being isolated and in rooms for so many hours without being able to get a break, without being able to get out or connect with other people, which is such a powerful part of healing. So the document with No Healing Staring at the Ceiling was developed to really look at the whole person and to look at all of the ways that we actually belong and stay connected, but also the ways that we stay well. And so with our advisors, we were able to develop just some general categories and some specific links that would just encourage people's curiosity to be wondering what else is out there, what's more connected to what I want, what I like, or who I am. So under brain fitness, just looking at how to keep your brain busy. And this isn't just about entertainment. This is about engagement. This is about, really improving your brain's capacity and using this time of being in hospital to actually heal and grow. And we found that so many people were really, really powerfully impacted by the constant staring at the walls every day. Staying connected, community and belonging was really powerful from the perspective of understanding that not everybody has someone else in their life. Many people are alone. We actually have so many folks who die alone in the hospitals that we actually have teams that come and sit with them so that no one dies alone. And in understanding that whole fitness is what is connected to ending PJ paralysis. So this belonging and this sense of being able to stay connected is a powerful piece to reminding people that they matter, that their healing is important, and that they've got something to look forward to as they move on and move out. I've got this, how to stay physically well and strong. But what we were looking at is how to stay well and strong in an 8x8 room or from a bed. And so we got really creative with looking at chair exercises, bedside exercises. What can you do in a small room? It's as easy as having a couple of cans of soup to lift up and working out. So being really innovative and creative with how to keep yourself fit so that you don't start to see some of those losses that Paul was referring to earlier on, but actually that you can be more well and healthier when you leave, not just from whatever brought you into the hospital, but in so many other ways. Finding my Zen, that's about wellness and self-motivation. What it takes me to get up and get going every day is different than it does for you and everyone else. So this was really about getting to know yourself, finding out who you are, finding out who you used to be. What would give you peace? What would give you some of those times to just relax and reconnect that you've lost, that we've all lost, I think, through some of this busyness. And so just really connecting with who you are and what matters to you. And then this one was one that our advisors really connected with. But what I love to do, and this is the art of following your passions. Spiritual connectedness came up a lot in our discussions, but also remembering, what did you used to love to do when you had spare time or downtime? Because that is what you've got when you're in hospital. So finding those things that you maybe haven't done in a long time, writing, painting, taking on some crafts and things that you used to love. And so reconnecting to those things that were your passion. Take me to the library. This was a really powerful conversation because we did so much learning. Our libraries have managed to not just become the keepers of books, but to stay current with who we are today. And part of that is being able to go on electronically, read books, listen to audiobooks, be involved in living books where authors are actually telling them, or watching stories, documentaries, and movies. And so really reconnecting with the library, but also in a way that you might find as a resource you stay connected with when you're discharged and back out in the community. And then also, not everybody is going to be coming from an urban center like Edmonton or Calgary. So connecting with the Marigold Group, because the Marigold Group is actually responsible for rural libraries. And so being able to connect with them so that no matter where you're from in Alberta, you can still access library resources that are connected to your home. Remembering to let go, the art of seeking ways to sleep. And this is really powerful, I think, for all of us. But remembering to let the day go, to clear our minds. When you're in the hospital, how do you get to the place where the noises, the sounds, the lights, the uncomfortable bed don't become the only thing you're aware of? So really finding ways to connect yourself to resting, to letting go, and to sleeping, because we know that so much healing is connected to how much sleep you get. Fabulous fun. This was one that was so powerful. Remembering to laugh. What brought you joy in your life in the past? What brings you joy today? And reconnecting to those things that just make you smile, because we have learned how powerful it is to engage with smiling and laughter and feeling good and letting that lift you up, because in the end, smiling and laughter and joy are contagious, and they're also such a big motivator for wellness. Casey?
We also decided to include a lovely musical resource called The Winter Solace, which happened last year in 2021. This was an incredible collaboration between AHS and a few local groups that came together in the name of music. All of the live concerts were recorded and super eclectic, and there is sure to be something for almost everyone. I've attached the QR code there and the link as well. In addition to the document that was created with clickable links, we decided to also create a QR code version for ease of access for patients and families, and also staff. We are very accustomed to seeing QR codes, and we felt that this was very suiting for this project.
So in closing, we just wanted to touch on where could we find this resource moving forward. Right now, it's gone provincial through the engagement and patient experience team. It's very much in the Calgary Zone throughout various sites and in the community. Many of the homeless sector agencies also pick the document up as something to assist with their clients and residents. And then through the Calgary Zone Patient Family Centered Care Team, and then Volunteer Resources has also sent it out on a provincial level. So at this point, this document doesn't have a home, but because we've heard so much about the power of it to help patients and families plan for admission, what to bring, what to consider, what matters to people, it would be a great document to have accessible for patients and families before an admission. And then, of course, while you're admitted, but it also is something that can go home with people. Maybe you've reconnected to something you'd forgotten about. Maybe there's something powerful that you learned about the world around you or yourself that you now want to stay connected to. And so we do need to find some places for this document to live, that it can be used as the resource that we've heard it really needs to be. And we've learned so much about the power of the whole person. And you can't end PJ paralysis and that getting up and getting dressed and getting moving unless you feel motivated to do it, energized to do it, and to understand that the whole you matters so much. And that's how this document came to be. Thank you all so much.
Thank you, Deb and Casey, for taking the time to share with us the intent of why you created this. That really you studied and understood that patients in the time of the pandemic needed supports, they needed resources, they needed something to occupy their time, and not only just the time, but to engage them too in different ways, whether that's physically or mentally or spiritually. So this resource is really unique. I really appreciate you bringing this forward for us today. And, I think it's quite timely. The use of QR codes and other technology has really been thrusted forward in the last couple of years. Even you go to a hockey game now, you can order 50/50 tickets from your seat by simply scanning the QR codes. And wouldn't it be wonderful the day we come, hopefully soon, when we have these lists of resources at the patient bedside. So it would be as easy as a quick scan to get people up and moving and support them with ideas that they could change. So again, thank you for sharing. For those of you that have listened to this webinar today and want more information or where to get some of the QR codes, please feel free to email myself at paul.wright, WRIGHT, @ahs.ca, or reach out to one of your colleagues within the community of practice around PJ Paralysis, and we'll do our best to get that to you. But again, thank you, Deb and Casey, for inspiring us all to be creative, be innovative, and be a bit different in these times of the pandemic. So thank you. As I wanted just to conclude our call today, I want to outline some of the resources that are available to you on top of what Deb and Casey just shared. We have a couple really unique pieces that I wanted to outline. One is the rehabilitation advice line. It is there to support you as a clinician or a patient or family for supports around getting up, dressed and moving, preventing deconditioning, or even understanding some questions you might have around your treatment specific to rehabilitation. So please call, inquire. If you have questions, share this with your patients, families, and even yourself. They are connected to our HealthLink 811 team. And again, they are a wonderful service to support you, your teams, and the patients in their recoveries. Hopefully you know by now that we have some wonderful resources dedicated to NPJ paralysis available on our Insight pages, as well as we have some external that are available to all organizations, communities, and members that are very similar and mirror each other. They're there around the health benefits, how to get involved, and some of those resources and frequently asked questions. So encourage you to share or to take a look at yourself. We also know that this initiative has brought forward much attention within the media over the last few years, and encourage you all to take a look at what's available out there around some of the unique pieces of embracing patients and families and telling their stories. And my favorite part about this initiative is how it's made a difference to our patients in the hospital. And here are two wonderful examples sharing some unique ways of how they felt it's made them have a faster recovery, give them a better outlook on their hospital stay, and prepare them for going home. So again, thank you for your time. I really appreciate your supports. And again, here on the bottom actually of this slide is how you can get a hold of that patient family center care team that could support you with understanding how to provide that resource. So their phone number as well as their email is there. I apologize, I forgot we added that, but thank you again for being a part of a community practice today. I wish you all well, and I hope to hear and see you all on the next call. Be safe, everyone. Take care.